Hi, everyone. Welcome. We're going to be starting in just a few minutes. I think people are making their way into the room. We will also have this saved and stream on our schoolsocialwork.net YouTube channel. Should be possibly going right now, though it's a little hard for me to check both as I'm going through getting things ready. But we will for sure have it up by later today. In the chat feature, if you're new to Zoom, and I reckon probably at this point we all had some Zoom experiences, but if you're new to Zoom, you can get into the chat by looking down at the base of your screen in the room. Go to chat. I've asked people if they're willing to just kind of introduce themselves and kind of say where they do early childhood pre-K work with kids and families, and we'll be meeting our panelists in just a few minutes. Additionally, in the link, I'll just put it in there again because I know we've got new people coming in. This is the Google Drive folder that has all of the materials that our panelists will be speaking from today. And those are the main items. We'll get started officially in just a few minutes. And this is my my dog who's decided to join us today. One of my two dogs, actually. You'll see possibly a cockatoo in a little bit if she decides to make an appearance. Okay, are we ready? You guys ready? Good, good. All right, we'll give people just another minute to get in. If everybody coming in could take their video off, I think we've got it set, the Zoom settings to mute people. I'll explain more about what that is and how we're gonna certainly make this as interactive as possible as we go forward. So let's get started. My name is Michael Kelly. I'm a professor at Loyola. So here's my Loyola shirt. I love being at Loyola. This is a real treat to be here today. I have three amazing school social workers who will be our panelists today. I'll be introducing the moderator in a minute, and we will dive right into the topic that everybody came for, which is to look at how to do pre-K early childhood school social work during a pandemic, which is what we're all in and what everybody here is trying to grapple with. So just a little bit of some housekeeping stuff before we get started with the presentation. This is the fourth of 5 webinars that we've been doing in this series. All the other 3 are now on our YouTube channel, schoolsocialwork.net. You can go get those. You can share those with your friends if they're in other grade levels. Lots of great resources there, also shared by school social workers just like you. One of the other things that you'll see as we go through the webinars, and you'll see a bit of it today with one of our panelists, is one of the other things I do in addition to being a professor at Loyola is I direct a program called the School Mental Health Advanced Practice Program, which is a 15 credit, 2-year, 99% online program to allow you to become the kind of social emotional leaders that we all are and want to be and want to build those skills further. I often joke that it's kind of the material that you wish you'd either learned in grad school or wanted to go deeper on. And we have one of our panelists is in the SMAP program today, and she may talk about a little bit about that. But that program has heavily informed what we're doing today, which is that I try to encourage and mentor and empower school mental health professionals to be leaders. And so we're about to see some of that where our panelists are going to show you what they're doing, how they're trying to help support their communities and their parents and their schools. So if you're interested in any of that, you can go find stuff up about it. I'll put some links in the chat as we're going along today. We are looking for applications by August 1st. And anytime before then, you're welcome to get stuff in. Another announcement related to Loyola is we have a summer institute we do, which is a CEU-based event. So the other one is graduate level credit. That is going to be July 16th and 17th. Again, I'll put a link to that as we go through today. And a lot of you have seen that on School Social Work Network. That is a wonderful opportunity to come together, really learn a lot of the things that we're going to hear about today about how to enhance your practice. It is 13 CEUs. And this year, because of this crisis we're in, it's completely virtual. So you can be anywhere in the country or really the world and come join. But we welcome you to do that as well. And I guess the final thing that I want to note, because it's going to come up later and I don't want it to kind of come out of nowhere, is we've put into the chat already a link to the Google Drive folder, which is where all the stuff that our panelists are going to speak from is living. All the other presentations, including the one that's coming this afternoon, the middle school one, are also going to be there. So you can go get those, you can share those. Everything that's there is meant to be shared. You'll also see in that document a link on a Google Sheet, which I know we're all getting good at using all the Google tools, suite of tools. It's a sign-up sheet for any and all people that hear this today or who are talking to friends in the field who want to continue to have these conversations in a more kind of intimate space where we have a professional learning community, where people want to talk about early childhood pre-K work. And so I haven't put these three panelists up to say they're going to lead it, but we do have a lot of interest in people doing that. So if that's something you want to do, you will be welcome to sign up for that as well. We already have people that are signing up for the other grade levels. Also, and I will put the link for the docs again. As more and more people come in, if you want to say hello and tell us where you do your work, that would be good, because that'll give us another lens to go from. The last thing I'll say, and then I'll get out of the way, is we are going to mute everybody because we're going to not have enough bandwidth, sound space to have everybody unmuted and worry about background noise. So we will ask you to put questions and comments in the chat. Myself and my panelist colleagues are going to monitor the chat. We will make sure we try to answer every question we can by the end of the hour. If not, we'll for sure try to respond later on School Social Work Network. Yeah, and I think that's all that I have for that. Okay, so let's get started officially. This is the Early Childhood Pre-K School Social Work in a Pandemic webinar. I am so grateful and excited that these three panelists have agreed to be here and to share their expertise. The genesis for this whole series actually comes out of early childhood pre-K because there was a lot of chatter and discussion on our School Social Work Network about what people are doing and what people might want to do to come together to talk about these things. And some 3 steps later that became, well, let's maybe get together like this. And then it became, well, what if other grade levels wanted to do it too? And there was interest, and now here we are. So a big thank you to the early childhood pre-K folks for getting it started. You have 3 panelists, and the moderator that I want to introduce is going to take us through the rest of the session. Megan Berkowitz, LCSW, is a social work supervisor for Apple Tree Early Learning Public Charter Schools in Washington, D.C., and I've benefited greatly from learning about her work and what she's doing in this interesting time. So Megan, please take it away.
Hi, everybody. It's a pleasure to be here, and I'm excited to learn from all of you, and especially Gabby and Cindy, who will be sharing. And again, I do have little ones, early childhood kids actually in the background. So I think we've all been on these calls before with some noise. So just a little plug for us. Apple Tree Early Learning is in Washington, D.C. We have a network of 9 schools, and where I think we are really looking to share resources with people across the country is Washington, D.C. has universal preschool and pre-K 4. So every 3 and 4-year-old in the city is able to get a free full-day education. And so we have a lot of clinicians in the city who are really grappling with this right now. We have 2 amazing speakers today, and then I'm going to go at the end just to kind of round things out. We're first going to hear from Cindy Frett. Cindy is an ECE school social worker at Indian Prairie School District, number 204 in Naperville or Illinois. She's been there for 18 years working with preschoolers ages 3 to 5. She currently is completing her final coursework to receive an additional graduate certificate at the Erickson Institute at Infant and Early Childhood Mental Health. So she is really the expert on the panel. And if you are looking for some extra tips for being at home in the pandemic, she can talk to you about the ukulele and gardening. So I will go ahead and start to share my screen so she can get ready.
Okay. Well, thank you, Megan, for that introduction. I think we're all in this together is what we're finding. So I put together a couple slides just to kind of talk about some of the, I would say my go-tos in terms of looking at, what resources are available to families and also to my colleagues in the early intervention system, as well as the teachers that I'm working with. The first slide, I thought I would tackle it from kind of a systems approach and just kind of look to see, okay, so what is the school district doing? And when I pulled it up, these were some of the things that were put on kind of our front page. So I'm glad that as a kind of a macro system kind of approach that they were able to take some of the resources that all of us have kind of pulled together and kind of put out there. They put those out there for the parents. So some of those links you probably can link if you go to the Google Doc. You will be able to find some of those that we're using just at the system at large. The next slide kind of starts talking about one of my favorite websites, I would say at this point, the National Center for Pyramid Model Innovations, which is kind of a national effort. We've been using a lot of these different websites that are in this pyramid model for many years at the preschool. Some of you probably have used those as well. I would like to click on this one, Megan, if we can, if it'll pull it up, because it'll be a little bit more. So when you go to this front page, a lot of the resources that are listed on this very front page are the ones that I'm pushing out to staff. I'm pushing them out to parents. We've embedded them in some of our little learning plans. So if you're looking for some things for learning plans, there's some nice little social stories, why I can't go to school. Take a look at that page. Those are some great resources. So this is my go-to. So if you're looking for go-to resources, this is a nice one. There's also information in Spanish as well. So that's my top one there, I would say, that I'm using quite frequently through this pandemic. Even when it's not a pandemic, it's a great resource. So the other go-tos that I've been using are, of course, conscious discipline. If you're aware of that early childhood program. That's a good one to pull some stuff off. Somebody's told me that there is probably there's a free 30-day, where you can kind of hook on and get some free resources. So check that out. The other go-to is Child Mind Institute out of New York. Again, there's the link there if you want to go to it. This is one that I give to parents. So if you're looking for something for parents, this is a nice resource because there's like a little daily model thing, or just a little daily topic that they kind of pull up and they talk about. There's also access to, if you want to do telehealth, as a parent, so they can hook up through that. But I have found that it's been a very nice resource. And there's all different kinds of topics. It's not just the pandemic thing. This is another resource. There's resources for teachers. There's resources for parents. So again, go check that out. And then another nice resource. In fact, today I kind of went on there and I thought, oh, let's see what's the topic today. And I pulled it up and it was self-care. Of course, we need to take care of ourselves too. So some other ones are just favorite, another little social story on YouTube. We've used this, embedded this in one of our little lesson plans. It's a nice resource. The other one is the 0 to 3. Don't forget, a lot of our kids are developmentally delayed. They're developmentally, they're at that younger age. A lot of resources at the 0 to 3 are going to apply to some of these early learners because they're just not at that age appropriate level yet. Other resources are the Midwest PBIS network. I'm sure some of you from other states have your own state PBIS as well. Check those out. There are so many resources out there right now. I find myself starting to get a little overwhelmed. So make sure you're in a good spot. Again, that self-care is very important. So those are some of my favorite resources on that page. The other one is, through all this, we're picking up all these other resources, and kind of on the back burner is all the loss and the grief that all of us are facing, whether it's a loved one that we've lost or just the loss in general, the loss of the life that we had. This has been, before the pandemic, this was one of my favorite, and a little plug for Dr. Wolfelt here. This was one of my favorite resources to go to for grief and loss. And he put together a nice series of letters that parents can read or other adults can read. This nice YouTube link that's on this page talks about how you would talk to a child. And he's very simple. He breaks it down, and he does it in a very soft, calm manner. I have just thoroughly enjoyed listening to that as well. And again, this is one of those resources that I recommended that they put on, not that they put it on, but they put it on the district website. I was surprised that it had made it up there. So somebody else liked it too. So, never underestimate the power that you have to give someone some of those resources. So I felt good that I made a little contribution there. So that's that one. And then, of course, and Megan and Gabriella can speak to this again, but just a little sample of one of the lesson plans that actually I didn't put it together, but the school psychologist that I work with, Devin, who's a picture down at the bottom there, she put this together, again, based on those resources that I sent out to everybody. So she was proactive in putting together a couple lesson plans that we've kind of shot out through our early learning programs. So that's kind of the end of my presentation. Those are the ones that those are my favorites. So go check those out. There are so many resources out there now. It's just amazing. I plopped a slide in here about just the early learning community that I've helped establish, but we will talk a little bit more about that one later. So thank you.
Thank you, Cindy. Again, if you have any pressing questions, just pop them in the chat right now. Like Michael said, everything is available for you, so you can click on all of those links as you go. So next up, we have Gabriela Ramirez. She's a school social worker with the Chicago Public Schools. She has a degree in psychology from the University of Illinois at Urbana-Champaign and her master's degree in social work at the University of Chicago. She's in her second year in the School Mental Health Advanced Practice Program at Loyola with Dr. Kelly, so she is a good resource to ask about how that goes. She attended Chicago Public Schools as a student for 14 years, and she also, like Cindy, has been working as a school social worker for 18 years. And she right now is at an early childhood specialty school with students between the ages of 3 to 7. And I know talking to her, she has a caseload that would just blow your mind. So she is also a very good resource to connect with. And she's going to talk to you guys today about a support group at her school for parents with children with special needs and how she's adapting that to the new virtual world.
Okay, thank you, everyone. I'm glad to be here with you all. So I just want to talk a little bit about what I've been doing, thinking about doing. I know this is an overwhelming situation for a lot of people, and you know, it's still like up in the air. We're not sure. There's a lot of uncertainty. We're not sure what's happening or when it's all gonna change. So this has been a process, I think, for all of us. If you can go to the next slide, Megan. So Megan talked a little bit about my background. I just want to stress that the School Mental Health Advanced Practice Program has been wonderful. I've learned about so many resources, evidence-based interventions, working in schools. And I think as a school social worker, you know, there's many times where I feel like I'm reinventing the wheel, you know, like I know somebody has had to deal with this issue. So I think this program really brings all those resources together to be able to become more effective as a school social worker. So I really enjoyed that. You can go to the next slide. So the school where I'm at is a specialty school, and it's early childhood. So we have kids who transition out of the early intervention services from the state, and then they're evaluated by our district and they're placed to us. So these are kids who have pretty moderate to severe developmental needs, could range from developmental delay, autism, or some kids who are, you know, very medically complex, have a nurse with them at all times. And then we also have 3 classrooms that are blended pre-K classrooms. So the kids who are in the general ed classrooms, they transition out of our school at the end of or prior to kindergarten. So we go to first grade for the kids who have an IEP. So as part of my school change project, through the school mental health program at Loyola, so I'm doing a parent support group, and I had already been doing a parent support group, but as part of my school change project, I decided to change it up a bit to provide more support to parents. So for example, when I first started at this school in 2012, I was doing a monthly meeting for parents, and it was just to give them information of various resources, and I would do English and Spanish. And so that was hard to go back and forth translating and when people had questions. So when I thought about my school change project, I really thought, you know, parents have to have their own, you know, separate space and opportunities to just make connections with other parents in their own language. So part of that, my school change project involved offering the parent support group in both English and Spanish, and also increasing the sessions. So prior to the school closing, I was doing a parent group every week, alternating between English and Spanish. And I had various topics that I would talk to the parents about. But basically, the purpose of the group is to reduce parental stress. And at the beginning in October, I administered a parental stress scale. And my hope was that in May, I would do the post-intervention survey for the parents, but that's not going to be possible. But I still want to provide parents with supports. And so I broke up the group into 3 sort of categories. So providing parents with information, practical resources, and also providing them with an opportunity for a social support network. You can go on. And so when I thought about what to do during this pandemic, I mean, the first few weeks, I think we're all like waiting, like, is this really happening? Or, you know, how long is it gonna go? Or I never imagined that we'd be out for the remainder of the school year. So I think it was really hard to come up with supports because we were not sure, you know, what was gonna happen in the schools. And then a lot of it was that there's just so much information out there that it's just very overwhelming. And I kept thinking, okay, I have to organize resources by categories. I have to do this, I have to do that. I did know that I have to start with basic needs because it's so important. You know, so many people lost their jobs. So many people, you know, are dealing with, you know, trying to work from home or dealing with, you know, obviously illness or loved ones getting sick. So there's just a lot of stress. And so one of our clinician delegates for the union shared this resource with us. So the Chicago Teachers Union compiled a list of resources and it's organized by categories. So food, how to apply for unemployment benefits, tenant rights. I mean, just a variety of resources. And I thought this was good to share with parents because I don't want to overwhelm parents with one, you know, message after another. So this was a good one where they can go at their own leisure and look at what the resources are. I've also had some questions from parents about, am I getting money for my child? You know, so I've tried to provide them some information about who qualifies for federal stimulus money, you know, when they can expect that. So unfortunately, there are a lot of people left out from receiving support from the government. So I recently found out that if a US citizen is married to an undocumented person, their entire family does not qualify for federal stimulus money for COVID relief. So that was really disappointing for a lot of families. So even if they have children who are US citizens, they're getting zero money from COVID relief. So that's been hard. Something that I plan to share with the parents is in Illinois, Governor Pritzker expanded the SNAP benefits, so the food stamps. So I'll be sending a message to the parents about that because that just happened in the last couple of days. And you can go ahead. So definitely basic needs are a priority. But then I thought, you know, how do we share information to parents? So when it was the last day of school, I did share a social story with the parents and everyone, we shared it through email, through the Remind app and also paper copies with the kids. So if you just want to click on that, Megan, I mean, it's just a simple story put together by Easter Seals. But I think, you know, in early childhood, the visuals are so important. So that's just an example. There are many, many out there. Okay, you can go back to the presentation. Sorry. Okay, and then I want to share a resource that's very important and has been super helpful for me. It's this, I learned about it through the school mental health program. So it's a program called Affirm, and it's autism focused intervention resources and modules. I've gone on this website because they offer training modules for parents and professionals to learn about various evidence-based programs for working with children who have autism. So recently I was doing a module on video modeling, which is amazing. I didn't get to finish yet, but I'm hoping to go back. But anyway, a firm developed a COVID-19 toolkit, which is so amazing. So that I shared that with parents, and that's been translated into, I think, like 7 or 9 different languages. So it's awesome. I share it in English and Spanish. I probably will also share it in Polish. But it's a whole toolkit with helpful information for parents about how to establish routines. It includes pictures to develop a picture schedule. It talks about, taking a break, like a mental break, a movement break, and then pictures with, for example, going for a walk, going to ride a bike. So kids who are nonverbal, and all kids in early childhood definitely need that visual support. Parents, if they have the access to print them out or show the kids on their phone, that's a good way to engage the kids. Also calming strategies, and then even tips on how to connect with others, like maintaining that social distance, but still, how to FaceTime someone, or, writing a letter, or just different ideas for parents. And then they also include like crisis lines and, how to deal with, just the stress that people are facing. So that's like a one-stop shop. I love that resource. It's been amazing. And I love that it's in so many languages. So that's the information part. So I'm still, just trying to reach parents. Like now with not having a person-to-person contact parent support group, I thought, well, how can we continue to provide parents with social support? And I think one of the ways is that we use the Remind app at our school, and we're constantly sharing messages. The teachers use the Remind app to also post their lessons. They're also on our website, but the Remind app is used as well. Our assistant principal, who was amazing, developed a video. She put together a video, and with all of the staff members' pictures, and we put messages on there. So the kids loved seeing that. That's also on our website. The teachers have regular office hours. They're available to support the parents or answer any questions. And I think in early childhood, definitely that there needs to be flexibility. So, we can't expect the kids to be available for a virtual lesson. I mean, I don't know how realistic that is. If they nap, they have to eat, do everything that little ones do. So there is flexibility in pre-recorded videos or lessons. And then I sent a parent, a message to all parents, just sharing the resources with them and saying, I'm available if you have questions or concerns. And then, and I have received several emails after that message. And then another way is, on our website, the teachers are amazing and they have their classrooms listed. They post pictures on there. And some of the parents have told me, my son asked me to look at the pictures on the website. So that's a great way to connect and, remind the kids this is temporary, and look at your friend on this picture. Remember when you guys were doing so-and-so activity. So that's a good way to help the kids remain connected, and for the parents to feel supported as well. And again, this is the resource on the Affirm, the modules and the toolkit. And then another resource that I just came up across is the Center in the Developing Child. So that's out of Harvard. And they also have like a toolkit or a guide that you can share with parents. And they offer articles, just information, videos, and also infographics. So the next slide is an example of one of their infographics. It's hard to see, but I think this is a lot of information in just one nice picture that can be shared with parents about, how does this whole pandemic relate to child development. So there are a few other infographics and just links to videos and child-friendly activities. So that's a great resource as well. As far as supporting the children directly, so a lot of the students that I work with are nonverbal. They're a lot of them are on the autism spectrum. And so even if they're already like first graders, they struggle with the verbal communication. So what I'm working on is establishing a weekly theme. And so I have an idea for weekly themes. And so I use the Second Step program at our school, and some of the teachers are also implementing that program. And so I'm going to be starting with like reviewing what the listening rules are. There's a learner song, talking about different feelings, frustration, anger, disappointment. There's a whole lesson, and it gets reinforced every time with what are the calm down steps. And then just another topic that I thought would be helpful is like how to share, take turns, play nicely with siblings. So those are some of the themes that I plan to, just talk about with the kids. And the way that I'm going to do it, I won't, unfortunately, because we're in a specialty school and there's a high number of special ed meetings. I won't be able to do like direct therapy individually with every child. I do a lot of groups, but what I plan to do is send links to the parents with the Second Step lessons, which are available for free. And I think it's amazing. They're going to be available through the end of June. So if you can go to the next slide. So that link there, Second Step, you'll be able to find videos on from pre-K early learning all the way to 5th grade. They have visual supports. They have posters that you can share with parents of the calm down steps. There's just a wide variety of resources on there. So I'm loving the way that it's organized. And then I haven't done this yet. One of our teachers at my school is doing this, but they're using Screencast-O-Matic to make short videos to send messages to the kids, or to do screen in screen. So like if it's circle time, the teacher is following along the movements of the song in the corner of the screen. So I haven't tried it yet. I'm not real tech savvy. I'm going to give it a shot, but I think that's a good way to personalize your message or personalize a lesson. So for example, if I want to talk about, calm down steps, right? I can start by introducing the lesson and then going directly to the Second Step website. So that's a good way to do it. I'm still working on it. That's a work in progress for sure. But that's all I have. If you have any questions, let me know. Thank you.
Thanks, Gabby. And Michael, is there questions popping up in the chat?
Yeah, I mean, we could do some now, or how do you want to do?
I think doing some now would be great. And then I can pop in when those questions are done.
Great. So one question, I can go back on video. Sorry, I didn't mean to be this disembodied voice. Hi again. So first of all, Cindy and Gabby, thank you so much for what you presented so far. A couple things that I saw in the chat then is wanting to confirm, and maybe this is a good one to Gabby first and then both of you to answer too. How are you staying in touch with parents? I know there was a Remind app you referred to, Gabby, in your presentation, but if you could talk about like what tech you're using or just kind of what strategies you're using, and then maybe we can hear from the other panelists too.
Yeah, at our school, so we do use the Remind app, and that's how I've shared resources about, like Chicago had rental assistance for a little bit. They had, or maybe still do, I'm not sure if those funds are still there. They had, so the CTU resources from the union, I shared those through the Remind app. So I just make sure that if I do send a message, just keep those lines of communication open. Like if you have a question about this, or if there's a resource that's not listed and you're in need of, please email me. So also our website has, like, for the teachers, they share anything that's shared through Remind is also on the website. So all the lessons, all of the videos, are on our website. So that's how I've been doing it. And then as I introduce the weekly themes for social emotional learning for the students, that'll come with a lesson that'll come with a message for the parents as well.
Right.
So how they could support that lesson, or at home ideas for supporting that lesson.
And before we hear from Megan and Cindy, just to clarify, so it sounds like the lesson plans and the things, the very cool stuff you were planning is about to happen because of the spring break maybe that CPS had, or just kind of your lesson plan time. Is that right? I mean, I'm hearing you talk about something you're about to do. You're still muted, Gabby.
Yeah, we did have a couple weeks where we weren't sure, like, are we going back? That kind of held us a little bit in suspense a little bit. But yeah, right. We had our spring break week, and then last week was our first week of remote learning.
Got it. Okay, great. Good. Thank you. Megan or Cindy, whoever wants to answer the same question.
I think our school is using, of course, Zoom, email. The teachers use the Remind app. I haven't had access to that yet. But those are the main ones that we're using.
Okay.
And I don't want to sound trite, but I think that we really come from, like, we do need to meet the parents where they are. And I think we found over the last 5 weeks, like the settling into like who we can find, who we're connecting with, how we're doing that. So some of our campuses use Classdojo, and we've really supported the social workers with working with the teachers to make sure that the line of communication is streamlined, where families aren't getting so many calls from a lot of different people on a lot of different platforms.
Right.
And so if text is the one that works the best, or phone calls, we're using Google Meet for direct services with a backup of DoxyMe if the family has had data issues with Google Meet.
Right.
And what we've really found is oftentimes the school social worker is kind of like the one that gets in touch first, and then shares out with the rest of the team. Like, the family is only answering text from 7 to 8 p.m. and that's when they're really in it. If you text her before that, she's not going to get back to you. So I think right now we're really in, like, we've kind of figured it out, but it's kind of all over the place.
Right. Well, and I think what you just said though about having gotten to where you figured it out and the time frame, I think what when this first hit, I think people had this idea that we would just like go in the back in our districts and come out with a plan in a week. And like, even the districts that did that, which there weren't that many, that I was working with nationally, even that they've revised their plans extensively, right? Or they had a really great plan that was contingent on these parents contacts happening all the time. And it's exactly what you just said, Megan, that they either weren't getting responses from parents, or the responses they were getting were very kind of time sensitive within the parents' needs, because parents are obviously, and we're all in it, but like parents are dealing with job loss, health issues, worries, there's a lot of other things that not come before school, but are on their minds as well. So I appreciate you giving that context. And I think that the other thing I would just answering the question is, the important thing is not that there is one answer to that question, but that the answer really be attuned to your parent community and also what your district is willing to support, right? Like they have to support something that you're going to do. And that's important too. There was another question, Megan, that I wanted to maybe ask everybody, because I think it cuts to everybody's stuff. The question about IEPs and mandated service time, how people are managing that and what the expectations are for you doing that. And maybe if you're not directly providing it, what the people you work with are doing. Cindy, you want to take that, or Megan, go ahead.
So I can answer just from the DC perspective. So I know that our office for the state superintendent for education has been funneling the guidance from the feds through us about that. And so what we've basically done is, as much as possible, try to meet the requirements of the IEPs through direct service. But if that doesn't meet the needs of the family, then tailoring it as such. And I think we're really in the position now where we're figuring out the best way to document that, because if consultation is the best method for the family, but consultation isn't on the IEP, figuring out how to appropriately document that. And then we have a number of campuses who are doing a really great job with co-treating, where maybe if they actually weren't doing much co-treating before, they're really trying to do that now, again, to get to the issue of if a child has 5 different related services and specialized instruction, that having 6 different calls multiple times a week is very overwhelming. So how can we co-treat as much as possible?
Yeah, thank you. Cindy, do you want to weigh in on that? How it's happening?
Sure, I can kind of jump in on that one too. We've been doing a lot of parent-led lesson plans, but this week we are trying to incorporate a little bit more into some Zoom calls, and it's still parent-led. But in addition to that, we're pushing out some SEL lesson plans that again, parent can do with the child. So that's kind of where we're at right now. I don't typically have a large direct service caseload right now. I have a lot of children on consult. So my push has been to keep that relationship with the parent and give them some hands-on activities to do with the kids at home. That could change in the next week or so, who knows?
Thank you. Gabby?
So for us, we are approved to, we're able to use Google Meets to meet with the families, to meet with the kids. They're little, so we do have to let the parents know, things are not confidential and all that. But like for our students who are so young, I'll be doing mostly consultation. So all of my direct service minutes students also have consultative service. And so like, I cannot bill for direct service unless I'm directly like on a screen, with the child and parent, or over the phone. So I think that's going to be really hard to do, especially because most of my work is doing social skills groups. And so I'll be doing mostly consultation.
Yeah. No, thank you. And again, you can see the array of ways people are doing it from just the 3 of you. There's another question, Megan, maybe before we move to the resources you were going to share. I'll just read it because it's a good question from Christy. I'm going to get your name pronounced wrong. Sorry. Brzezinha. Nina, is anyone doing initial evaluations as related to child find for the preschool population? Our district continues to receive calls from parents who are concerned for their child's development, as well as children who are scheduled for initial evaluations. When we closed. So any thoughts on that? Anyone want to take that one?
I can step in on that one. We are still doing initial evaluations, but it's basically on those children that are coming from early intervention that have an IFSP plan. We're doing a basic parent interview via Zoom and taking that information and then contacting early intervention therapists as we can. We have not done any yet on children who just come through, say perhaps with an ages and stages questionnaire that's been filled out. We haven't tackled that one yet. So we're there just along with you guys. So we'll keep plugging along.
Yeah. Anybody else?
I was just going to mention at my school, we don't do those evals straight directly out of early intervention services. So we have early childhood evaluation teams. So at this point in time, I'm not sure how they're doing or planning to do evals. I haven't heard yet.
Yeah. And Megan, this one actually relates to what I just asked the panel. Someone, Maura Connor, I believe, asked about open evals that can't be completed, both initial and re-eval. And it sounds like there's, like Cindy said, there's people kind of still trying to keep that going. But there are districts I'm hearing of, maybe less so in the early childhood realm, more in the K-12 part, where they are essentially either pressing on with everything, all systems go. And some districts have actually just kind of paused those. And it's an interesting question because I'm not sure legally that's that's doable, but some districts are defining the crisis as allowing them to do that. So I'm curious to know like what you're seeing where you all are as well.
DC, I think on a scale of 1 to 10, with 10 being pressing on, is probably like an 8.5, 9. So we've been finishing all open evaluations, holding meetings, so we're sending students to kindergarten for the next year. So we're finishing all of those meetings. We currently, to my knowledge, don't have any new referrals. That doesn't mean that we wouldn't receive them. And so I think we're kind of taking everything as a case study in something new and using the guidance as best we can to fit the needs of the child.
Yeah. Anybody else?
We're kind of going case by case basis. So if, depending on the information that we were able to gather before the schools closed. So if there are some evals that definitely, like the team members did not have enough information, those are going to wait until we reopen.
Right. Okay. Maybe let's go to Megan if you have additional information you want to share with the group before we kind of start winding up. You're muted there. Sorry.
As I hit share screen with no screen. Okay. Okay, so I wanted to just round everything out as it's loading. Kind of just talking about the structures. I think that Gabby and Cindy really hit on everything. I think we've all been very overwhelmed by all of the resources coming out. And I think, again, like we've hit this 5-ish week mark where we kind of are starting to learn like what we really feel comfortable doing. And I know in the very beginning, I was very overwhelmed. And as the school supervisor, I wanted to mitigate that overwhelming feeling as much as possible for my team, which I know wasn't totally possible. But we really, I really wanted to keep these goals for my team because I think, to the point that we just talked about, like going full steam ahead, fulfilling hours 100%, keeping 25 to 30 minute social skills groups a week is just not physically possible in this environment. And so how are we really grounding ourselves as a team and what we can accomplish? So there are really just 3 goals that I'm asking my team to focus on, which is maintaining relationships and connections, because we know that's the foundation for so many of this. Supporting well-being and safety of families. So do they have what they need for resources? Are you making sure that they're connected to either us or another mental health support? And then if families are ready, continuing to provide that skill building and counseling that we were doing in the school setting. So really what we're doing, we asked social workers to, right before we went out, identify all the students at their campus that they wanted to maintain connections with, either for case management or social skills groups or counseling, and really what are the families they were going to really hone in on. We created a shared resource drive that they continue to access and add to. And then we have a number of, obviously like other cities, a number of free food sites, but not all of those sites are accessible by public transportation, or if I am 3/4 of a mile away from a grocery store or a free school site, going there with my 3 kids, and maybe I don't have a mask for all of them, it's just not possible. So we have been supporting grocery and like provision delivery through either Instacart or other methods. For direct services, again, really just trying to like mitigate the overwhelming feeling for everyone. We have a rubric for our social skills group, which really says like what kind of key things should you be hitting when you're providing social skills groups in the school. We modify that for home. And so as you can see from these steps, we're really saying that social skills groups could really be like a max of 7 minutes. And really the main goal of this is like maintaining that connection and relationship first, and then the skill building or the skill maintenance really is secondary. And so as you can see, we have 3 and 4-year-olds, as we all do. And so asking a 3 or 4-year-old to be by themselves on Google Meet or on the cell phone is nearly impossible. We have a number of hilarious stories where the child is given the phone and then they just put the phone down and go about doing something, and the clinician is on the phone going, hello, hello. And so really working as much as we can side by side with the parent, at least if the parent is in hearing distance for them. And then we've also, like a number of other people have mentioned, we've updated our telehealth consents for counseling just to be really clear that we can't totally maintain pure confidentiality. We also added a clause in there that said that we really want to abide by the NASW tech standards, which really do say that telehealth might not be appropriate for all parties, and we need to assess that. So if the clinician and parent together decide that telehealth isn't the best method, then they can decide together what else can be done to support that. Again, like I mentioned, we are really hoping for family support during the sessions. And again, if the family is just not ready to do 10 to 15 minutes once a week, we totally support that. How else can we help you during this time? And then also all of our social workers are helping at their campuses. We have 9 campuses and 9 social workers, so 1 for each campus. And they're supporting in a number of different ways, not anything that's totally new that's been shared, but recording SEL lessons and posting them for all students. We're currently working on a series right now where we're recording home behavior management videos based on parenting with strong-willed child, which will be a series of 90-second to 2-minute videos going through all the steps for that I'm happy to share out with the network when they come. Our social workers are joining class meetings, and then we also partner with Georgetown University for some mindfulness sessions for staff at specific campuses, knowing that we really do want to support staff during this time as well. And then as well as this social work team support, we've moved to weekly virtual group supervision. So we were having monthly group supervision before. We're now doing it weekly, also to maintain relationships and connections with each other. I've tried to support a focus on reviewing the code of ethics during this time as we try to apply all of that, and then sharing out resources and reminders to everyone through weekly team memos.
All right. Well, thank you, Megan, and thank you, everybody, panelists. I had a few kind of last things I wanted us to do. We do have time if anyone has any kind of last questions to get those in. Another thought, and I know we've referred to it a few times today, Cindy, Gabby, and Megan are all part of School Social Work Network, and I imagine a lot of you might be as well. I will try to put a link in case you're not. If you want to join, it's 100% free. It's meant to be a social media platform where we all come together and do things like this, and also lunchtime live chats, which we're doing Monday, Wednesday, and Friday. It's lunchtime in Chicago. It's maybe not lunchtime everywhere people are today. It's 11 to noon, Monday, Wednesday, and Friday, and you can get there on our site and just chime in and just come whenever you're interested and want to do that. I will also be having people continue to guest host with me, and maybe some of the fine folks that were on today, I'll be seeing if they're interested in doing that. But mostly what we want to do, I think, in winding up today is to just kind of take it to what awaits us and what we can do to keep going and keep being confident that what we're doing is making a difference. I think you've heard a lot of tremendous examples and resources and just passion and care from our 3 panelists today. And I want to just continue to encourage you to find spaces where you can, get fed or get inspired, like I've been today listening to the 3 of them. So to that end, we have in our Google Drive folder, if you go and want to do this, we have the option for people to elect to sign up to be part of a professional learning community that we'll be organizing in the coming month. My sense is that, like any group, we need enough people to run it. And, we haven't set like an exact number, but realistically, we'd want to do it with a group of people that are committed and want to do it for at least a couple months. I put in the chat, it might be something that people do through the rest of the school year, and then decide to pick up again in the fall, or may say, hey, let's keep going through the summer, because one of the big issues that I'm seeing again and again, Megan, Cindy, and Gabby, is people are beginning to, as much as this situation is still crisis and still full of lots of things that are uncertain, there's also a new uncertainty, which is if and when schools reopen, how are we going to make sure they reopen well? And how are we going to manage what is undoubtedly a traumatic situation happening to all of us in real time, but is also going to have new traumas that come to school. And, we don't need to belabor what those are, but certainly, if there are people directly affected by the COVID crisis in your school community, that's going to be one trauma. If there are people who have had massive economic impacts, which there will be, that's another trauma, and all the other things that we social workers know often come with people who are thrown into economically desperate circumstances. All those things are going to be part of reopening schools. So if any of that lands for you to say, hey, I want to stay after this today, I want to stay part of this, I welcome you to do that. And I'm excited to think about that more with this group. So the last thing I guess I just want to ask is, we've got a few minutes. If each of the panelists just want to offer any last words about something they would say as a takeaway, or something they would wish for the webinar attendees to take with them today. Maybe Cindy, can I ask you first, something you'd like them to take with them?
Sure. I think it's a big takeaway would be to continue to reach out to a platform such as the School Social Work Network to explore, how everybody else is accessing resources, or, coming up with lesson plans for the fall when we get back. A PLC is a great way to access that. I'm happy to look forward to that PLC. So that's my next avenue as well.
Great. And just so everybody knows, we will, as a whole group, all the webinar presenters are going to be meeting next week, and we'll have more news about those if and when we put them together. Gabby, you want to offer anything? Oh,
Sorry. I just want to say that, I think it's normal to feel like you're not doing enough, and that's hard for social workers. But I think just be kind to yourself and be realistic, because this is a whole new situation we're in, and we just have to take it one day at a time. So that's it.
Yeah, I be gentle with ourselves. That's been a big theme of all these webinars, is that, it's easy to feel like you're not doing enough, or you're doing too much, or, am I doing anything sometimes? I think it was one of your colleagues, Sean, said in the webinar yesterday, is, what just happened today? Those kinds of feelings. Megan.
Yeah, I second everything that Cindy and Gabby said. I think that, again, we're in a time where there's resources floating here, around, everywhere. And I think really finding like your sweet spot, like what are the one or two websites like Cindy talked about that like are really your go-tos? What are the one or two approaches? What are the couple ways that you're really like maintaining those connections? I think can help mitigate some of that overwhelming feeling, but also support some of that, like, what did I actually even do today? Yeah, I just say don't be too hard on yourself, because everyone, like Cindy said, it has had a loss of some sort, at minimum, of loss of normal life. And so
yeah. Well, it's both a bittersweet way to end, but it's also a really beautiful way to end, Megan, with that, because I think what I've heard from the three of you, and we continue here in this webinar series, is just people really rolling up their sleeves, getting into it, and doing the best they can, and trying to help each other and be there for each other. So on behalf of all the other webinars and the one that's still to come this afternoon, I just want to thank everyone for being here today. Thank you very much, Megan, for organizing and moderating, Cindy and Gabby for being here and sharing your expertise. And again, stay tuned. Join us if you're interested in doing stuff on the network. And, you know, again, take care of yourself, be well, and know that those kids and those parents and those teachers really, really appreciate what you're doing, because they do. All right, take care, everybody. All right. All right. So Gabby and Cindy, thank you. Thank you. And Megan, I think maybe had to go off and see her little one, or little ones. I don't know, I'm sure how many she's got. We will be in touch, but you guys did a great job. It was great to be here with you, and we will talk soon. Okay.
Thanks, Dr. Kelly.
All right. You're welcome. Take care.
Bye.